afternoon, everyone. This is Christine at Health Current. Sorry we were having a little bit of technical difficulties on our end, but want to get started right away. I'd like to introduce Connie Ide, our Director of Programs here at Health Current, who will be leading today's webinar. We will have Eric with Dr. First on towards the end to talk about the products and services that Dr. First has that can help with electronic prescribing. And today's webinar, all lines are muted, so please use the chat feature if you have questions, and we will answer them throughout the webinar. Connie, I'd like to turn it over to you.
Thank you very much, Christine. Thanks, everybody, for joining today. This is the last webinar in our series. So while I am presenting this webinar, I'd like you all to think, do you think we should go through the whole series again before the end of the year? I'd be very interested if you put that information into the chat box. There are actually 4 different webinars, one for provider and prescriber readiness, one for the mandates, one for the one that we're doing today, and also one for the controlled substance PMP program. So think about that if you think we'd like to, if you'd like us to repeat. So today's webinar, as Christine said, is written and electronically prescribed prescription requirements. I would like you to know that today's webinar and the complete webinar series in our campaign to help everyone get going with electronic prescribing by the mandate date is a collaboration between Health Current, the Arizona Healthcare Cost Containment System Access, also the Arizona Department of Health Services, and the Arizona Board of Pharmacy. We all sponsor this and would like you to know that because everyone is involved in doing this. So the overview today, we're going to talk a little bit about all the things that were in Senate Bill 1001, which was the 2018, actually 18 for 2019 Opioid Epidemic Act, and also then House Bill 2075, which amended it and updated it. Today, we're also going to talk about physician assistant and medical practitioners, and also the pharmacy responsibilities. The overview, it's permissible, handwritten, Schedule II prescription situations, and record-keeping requirements. I'm also going to talk a tiny bit about the controlled substance prescription monitoring program, the mandate of it, and how to access it. I also have some exciting news to tell you about the Arizona versus the national landscape, where we're ranking at present, and also give you some Click for Control campaign resources. So let's talk a little bit about physician assistant responsibilities. Physician assistants are certified for 30-day prescriptions for Schedule 2, 3, 4, and 5 controlled substances that are opioids and the benzodiazepine. Remember that in the actual mandate, it specifically states Schedule 2 controlled substances that are opioids. That's what it actually says. So that is exactly what you need to be concerned about.
Connie, I'm going to stop you for just a second. It looks like we're still having some technical difficulties here, so I'm going to just see if I can stop sharing and try and get rid of, we seem to have a gray box that is prohibiting folks from seeing things, so I apologize.
All right, perfect. Thanks, Christine.
So, and for some reason, that gray box still seems to be stuck there.
What would that do?
No, it seems to be part of, no, it's this particular gray box, so I apologize for some folks here. We're going to see what else I can do to stop this. And it looks like I may be stuck. Oh, gosh. I'm going to keep working on it and see.
What does that mean? You're sharing two applications.
It says I'm sharing two applications, but I don't, stop sharing that one. Now it's just sharing the PowerPoint. But it's this gray box because I can log in and I'm seeing it. Oh, goodness. I apologize. Connie, I'm going to let you continue, and I will continue to try and work in solving this issue.
All right, folks, I'm sorry about that, but I think I can talk over it, so let's continue on. I also wanted to tell you that down in the left-hand corner, you will see that I've taken the information that's on the screen and that I'm talking about on each screen. You'll see down in the left-hand corner, this is House Bill 2075, and it is Section 32, Line 2504. That I'm talking about. So if you wanted to go to House Bill 2075, which I also have the link to later on in the presentation, you'd be able to find the actual verbiage that tells you about what's on the screen. So physician assistants are certified to do 30-day prescriptions for Schedule 2, 3, 4, and 5 that are controlled substances that are opioids and benzodiazepine. Also authorized and certified to do 90-day prescription privileges for the Schedule 2, 3, 4, and 5 controlled substances. Physician assistants are have limited limits and requirements, and the reason that I'm going through this is because in the original Senate Bill 1001, that was the Opioid Epidemic Act, it was the physician assistant information was incorrect, so it was amended in House Bill 2075. Going on, physician assistants must either have completed 45 hours of training for their license or be certified by a National Commission for Licensing Physician Assistants and meet other requirements established by the licensing board. And you'd need to go to your licensing board to learn what those might be. Physician assistant limits and requirements. Physician assistants shall not prescribe, dispense, or administer Schedule 2, 3, 4, or 5 controlled substances without the precise delegation by a supervising physician. That is a board-certified registered DEA, has a board-certified registered DEA registration, and the physician assistant must also have their own DEA registration. Prescription-only medications without delegating to the supervising.
There we go. I fixed it. I apologize again, Connie, for interrupting you, but you are now in control without the gray box.
Okay.
So thank you, everybody. I'm so sorry about that.
That's a little bit better. I was having a hard time seeing what I needed to be talking about. So I'll continue on here. Physician assistant limits and requirements. The second bullet, I'll continue from there. Prescription-only medication without delegation by the supervising physician, and they're not to prescribe, dispense, or administer prescription medication intended to perform or induce an abortion. And that is specifically for physician assistants that are operating as midwives. Physician assistant limits and requirements. Physician assistant shall not prescribe, dispense, or administer Schedule 4 or 5 controlled substances more than 5 times in a 6-month period for each patient. And that's important because sometimes you have repeat patients and you need to continue to re-prescribe. And to do that, you would need to get your supervising physician to do that for you. Then for Schedule 3 controlled substances that are opioids or benzodiazepine, you cannot write a prescription that's refillable without written consent of your supervising physician. So you would need to get that and keep that on file for yourself. You may need to also provide it to the pharmacist that you send it for if they ask for it. You're not to prescribe, dispense, or administer prescription-only drugs for a period exceeding 1 year. Only write a prescription for a year. Physician-assisted limits and requirements. Any physician-assisted orders must contain, and this is important, your physician assistant name, address, and phone number, and also the physician assistant DEA registration number, not the supervising physician. And we've had some who have made that mistake, but it is actually the physician assistant. Physician assistant must keep an up-to-date and complete log of all the Schedule II and Schedule III controlled substances that they administer or dispense. And if you have questions about that area, see House Bill 2075, which is Section 2532 for emergency situations, for MAT, that's medically assisted treatment, and dispensing guidelines and mandates. I didn't include all of that in this presentation, but that's where you would find that information. I've also included a few. We don't normally have pharmacists on this webinar, but I've included a few responsibilities that pharmacists have because it relates back to the prescriber as well. Beginning January 1, 2020, Schedule II controlled substances can only be dispensed by electronic prescription order. Remember that. If you're not live on electronic prescribing, you may not do Schedule II controlled substances. There's no waiver. There's no nothing for you to be able to do. You would need to get another licensed and registered person, prescriber, to do that for you, but you would not be able to do it. You'd not be able to do a controlled substance. Schedule II controlled substance order shall not be dispensed more than 90 days after the date the prescription order was issued. So in other words, if you give a prescription to a patient or order a patient a prescription even electronically, if it is older than 90 days when the patient comes in to get it filled, keep in mind the pharmacist may not fill the order. And the prescription, another point number 3 is the prescription order for a Schedule II substance shall not be refilled. So keep that in mind as well. It cannot be refilled. It has to be completely rewritten. Pharmacist limits and requirements. If there is a situation where you feel you need to verbally prescribe, the pharmacist may correct errors or omissions on written or electronic orders to the issue date, the strength, dosage form, and quantity of the drug, and also directions of use. So the pharmacist can correct that if verbally given the order by the prescriber. So in other words, if you see that it's wrong, you could call the pharmacist, or the pharmacist feels it is incorrect, he or she can call you, the prescriber, and you can verbally give them changes to those 3 things. Also, a pharmacist must document any changes made and the time and date the prescriber granted authorization to correct the original order. So in other words, the pharmacist keeps track of that. My advice to you would be to also keep track of it in your records that you verbally changed something on an order. The pharmacist limits and requirements, again, not covered in this presentation, are prescription orders to be completed for direct administration. In other words, I didn't include when a parent is given information or given a drug to directly is dispensed to give to the patient for the parent to do, or intravenously, or interspinal infusion. And that mainly is specific to pediatricians. Pediatricians often do compounding, and then rather than having a parent administer intravenously, they will do it in their office. It is also for long-term care facility residents and hospice care programs. Also, controlled substances directly dispensed to consumers. We're not talking about prescribed here. We're talking about dispensed. And also, which doesn't apply probably to anyone on the phone, but veterinary prescribing and dispensing is not included in this presentation. Medical practitioner responsibilities. Beginning January 1, 2020, let me see if I can move this. Beginning in January 2020, each prescription order that is issued for a controlled substance must be transmitted electronically to the dispensing pharmacy. I'm saying that again because, unfortunately, there is not a waiver. There's no way around electronically prescribing unless your system is down. I'm going to talk to you about what you do in that situation. You must, a prescriber, now we're not talking about physician assistant again, we're talking about any prescriber, limit the initial Schedule II controlled substance to a 5-day supply except when following a surgical procedure and then not more than 14 days. Let's see what else is. Hospice, palliative, end-of-life, skilled nursing patients, oncology, burn or MAT, again, medically assisted treatment for addiction, and infants being weaned off opioids. Medical practitioner and pharmacy responsibilities I put these in a separate situation because they do go together. They're both the same thing is necessary for both, and I wanted you to understand what each side has to do, what the practitioner has to do, and also what the pharmacist needs to do. Medical practitioners may write, and the pharmacist may dispense controlled substances when the electronic prescribing system or the pharmacy system, so either side, either the prescriber system or the pharmacy system is not operational, and then the pharmacist and the medical practitioner, you both need to keep a record of it when the system wasn't available and why, and when it came back up again. I would suggest you all, both sides, keep a book and keep a record of it so that you have it should you be asked about it. Also, keep in mind that prescription orders for the VA facilities, medical bases such as Luke Air Force Base, Indian Health Services, hospitals, or other Indian Health Services, clinics, and tribal-owned places, you may write those prescriptions. They are all federal, so keep in mind, federal prescriptions for patients in federal facilities may be written. You do not need to electronically prescribe them. And I usually tell folks that if you're on the edge of an Indian Health Services or typically right for the VA or the military base, you should get a hold of the pharmacies in those areas and ask them what they want from you and understand that you tell them that you will be writing paper prescriptions for that. You may write them rather than e-prescribe them, and make sure that they can accept them and will accept and fill them for you. Remember, they may not have electronic prescribing, the software to be able to accept your electronic prescribed prescription. So make sure you check with them before January 1 so that you know what you can do and what you can't do. Also, in emergency situations, pharmacists may transcribe oral orders. So in other words, if you're in a situation where you really need to do an oral order because of a trauma situation or some other situation that you would not have time to actually do an electronic prescription, you may call the pharmacy and transcribe, and pharmacists will take should agree to, and that's up to them whether they want to fill a prescription orally prescribed. They can do it, so make sure that you check that also out with the pharmacist that you use most regularly. And you as a prescriber that are required to provide a written or electronically prescribed copy of that order that you've asked them and they have dispensed from an oral or verbal prescription. I also want to tell you some exciting news. We'll talk a little bit about Arizona versus the national landscape. Some interesting things have happened recently that I'm kind of pleased with, although we have a long way to go. So let's talk about this a little bit. In SureScripts, which is a national organization that provides statistics about prescribing, any kind of prescribing, mostly e-prescribing and also electronic prescribing of controlled substances, as well as electronic prescribing for the legend drugs. In the SureScripts does a national progress report every year. It's done for the previous year, usually comes out in July of every year. So in July of this year, it came out, and in there it said that we in Arizona had jumped from 22nd place in e-prescribing of controlled substances in the nation to 11th place, which I thought was absolutely awesome. We were recognized nationally, and I was very proud of the progress y'all had made at that point. Now, some other very, very exciting news just came out as of October. Arizona ranked 4th in the nation. So we went from being 22nd to 11th to now we're 4th in prescriber readiness. And I've given you the map that was there. You can go and click on the next slide. Let's see, I have a slide in here with that, but it's not in here. I do. It's this slide. You can go to if you go to this map, and to get to that map on the bottom of this slide, where it has the link on the bottom of the slide I have up there now, you will be able to get to this map, which is interactive. You can click on the different states and see where they are to determine where we are, and you can see the other states if you have friends or are interested in other states. So how do we rank within pharmacies nationally? Nationally, 96% of all pharmacies as of October are EPCS ready. In Arizona, 99% of our pharmacies are. For prescribers, nationally, 44%. We're at 63% at this point. So we're 19% ahead of the national numbers. We need to keep that up. We've got a long way to go. If you think about it, only 63% of our prescribers who have a DEA number are EPCS enabled. That means we have how many more? 40%, a little bit under 40% to go. So 47%, 46% probably now since October. So we need to get moving on getting everyone that needs to write a Schedule II controlled substance that is an opioid needs to get going. The other important information that I saw a milestone come out here just recently, half of all states require some form of electronic prescribing for opioids, controlled substances, or all prescriptions, even the legend ones. So here's another map. There are 26 states that require electronic prescribing for opioids. So this is state laws as of June of 2019. So the reason I think this is profound, and you all should keep this in your mind, if you aren't up and running on your e-prescribing of controlled substances yet, you need to get moving, because with this kind of momentum across the country, the vendors who are nationwide will be very, very, very busy, and you need to get into their implementation schedule and get their software installed and going. So please get yourself going as quickly as you can. A few words I wanted to give you on the Controlled Substance Prescription Monitoring Program. It is a state-run database that collects patient information about dispensing in the pharmacy, and it's intended to catch people who are doctor shopping or otherwise abusing opioids. You go in, and I'll tell you in a second on how to do it. You go in and look to see what the past 12 months of their prescriptions have been, so that you can tell if you should be filling a prescription or ordering a prescription for them for opioids, or you should not be, or help get them into some sort of treatment. And that began in October of 2017. All Arizona prescribers were required to access the information on the PMP before prescribing. And there are a couple different ways where you can get there. So, and that includes any written and or electronically prescribed prescription. So it's both that you should be checking. And this is basically what you're supposed to do is review, as I said, review the preceding 12 months so that you can see what's going on with the person, what kind of prescriptions they have. The information is here. There's 3 different ways to connect to the PMP if you're not doing it now. You can go via the Board of Pharmacy website, and it's given you the connection there. So first of all, you do have to register, and once you've registered, you may manually log in, put your patient in, your patient's name, and find out what you need to know for the past 12 months. Also, you can access it through your electronic health record. Some of the electronic EHRs will provide the ability for you to do it right within that application. And then you also can access the PMP via Health Currents portal. So if you are a HIE participant, you can connect that way. If you need more information on it, you can look at the Board of Pharmacy's website. They have some excellent little webinars and little like YouTube presentations to help you understand how to get connected and register and all the other kinds of things with it. But I urge you to do it because I'm certain that the licensing boards are going to be looking at what goes on and who is checking the PMP and who is not. I do not know at this point what the penalty for not checking will be, so I suggest to everyone begin doing it if you're not already doing it. I'm not going to go into great detail here because I want to give enough time for the Dr. First presentation. So Eric, heads up, start getting ready. So I'll tell you a little bit more about these things, and then Eric will give us a demo on the Dr. First software. And as many of you, I think, on the line are interested in seeing is what do they have for their handheld device, and I know there are several on the line that are very interested in the handheld. So I'll let you, when you get these slides from Christine, go through all the resources and things that are available. But I do want you to know that we do phone-based assistance. You can call, and we'll help you. There's no charge for it. You can also communicate with me via email, and we will respond to your email. And when you call me, what I try to do with everyone that calls is I try to answer your question verbally and then send you an email to back up and give you in writing everything that I've told you. Some more things that are on our website. And also, again, as I told you in the beginning of this presentation, this is the last webinar in our series. So I'm very interested to know if you think we should repeat the 4 webinars again so that we can keep everybody up to date. We only have a few more weeks to go before January 1, which scares me for Christmas shopping. But in any event, it's coming up fast, guys. We got to get going. Closing remarks, probably the most profound thing I want you to know is the Health Current is a resource for EPCS and a solution provider for the CSPMP. So be sure that you check that. And I also want you to be I want to be very specific that this webinar is meant to educate you and help you understand and navigate adoption of EPCS. But I also encourage you to review and interpret the legislation and mandates yourselves based upon your own specific needs and situations. Don't just go with what's exactly in this webinar. My information that you can get to contact me. Also, if you are a Medicaid provider, there are some very specific benefits for you to join the REC. So go to recruitment@healthcurrent.org and join the HIE. And with that, I will turn it over to Christine and Eric.
Okay, Eric, I have moved you to being our presenter. If you are able to hear me and can share your screen.
Yes, hey, this is Eric Zimpom. Bear with me one moment. And hopefully you are now seeing my screen.
Wonderful. I can, Eric. Thank you.
Good deal. All right. Hi, everybody. My name is Eric Zimpom. I am with Dr. First. And just kind of brief background on who we are. Dr. First is an e-prescribing company. We do things regarding medication management. We're involved with this because we worked with the DEA in 2010 and actually created this EPCS technology. So going to show you briefly just how are controlled medications sent, web service versus an application service. What you're viewing here is a demonstration which I'll walk through on when you access this via the web. Connie mentioned using this on a mobile device. I don't have the best demo account for that, but I've got a very brief video. So I'm going to enlarge this. I'll talk through it. It's about 2 minutes long, and then we'll go through the demo from the web version. But what you're looking at here is that you'll have the capability of sending prescriptions via an app on your mobile device. This is controlled medications. You can pull med history, communicate to the patient afterwards that, hey, your prescription has been sent to the pharmacy, etc. So let me just show you briefly. Like I say, this at least gives you a visual of what all of this looks like. So here's actually the app. When you get in here, your patients will be in here. You'll search for a patient. All of this is pointing and clicking. So now you can incorporate PDMP, the interface workflow. We can do this on the app. You can do this on the web service. That way you don't have to check into both the PDMP and the e-prescribing component. But here you can just see, you'll type in medications, you point, you click, you pick out the dosage amounts, if it's extended release versus immediate release, etc. You can incorporate instructions to the patient, instructions to the pharmacy, and as you can see, like I say, a bit repetitive, I know, but a lot of this, it's very intuitive and pointing and clicking. But this, like I say, gives you at least an idea of what all of this looks like. You'll be able to pull not just medications, but you'll be able to pull the pharmacies that they go to and send the prescriptions directly to the pharmacy. What you're seeing here is in alert systems that are built into the softwares. This will pop up on the web service as well. But if there's a drug-to-drug interaction, drug-to-diagnosis, etc. So here we're showing how you send a controlled medication. We'll pull the medication. The two-factor authentication is built in this, as well as the web service, and I'll show you specifics on that when I do my demo on how that's entered. But here again, this is just filling out information for the prescription itself, entering quantity, and then the pharmacy it's going to go to. And then there's the patient support tool. So you can actually notify the patient after this has been sent and let them know, hi, this medication's been sent to, XYZ pharmacy. Here's some general information regarding that medication. And then here's an example of the two-factor authentication of entering a password and then entering the token number. And like I say, I'll go more into depth when I'm actually doing the demo. This at least gives us a visual of what this looks like on the phone. So you see starting to start the chat, so notifying the patient that the prescription's been sent. So all of this will be built in. And then the patient can communicate back. The nice thing with this, the conversation is it falls off after time, so there's a time lapse so that the patient can't simply just keep reaching out to you. But like I say, that at least gives you an idea of what that looks like in terms of using on your mobile device. So this is what it would look like on the website. A lot of the workflow concepts behind this are staff can queue up medication, They can enter patient demographics. They can do all of this. And then the provider can have as little input as simply releasing the medication at a later time. So the actual legwork can be done on the web side of things. The provider can be wherever, and they can release that medication via the phone app. So here we are on the web page. A lot of the same information that we just went through on the application is located here. It's just laid out a little differently, obviously. All the information is going to be on one page. So we've got the patient name in the upper right-hand corner. We have pharmacies here in the middle. The drop-down is going to provide pharmacies they typically go to make that nice and easy. You can point and click. You can add any pharmacy in the country, mail orders, all of this stuff is in there. And you can search by zip code, name, town it's in, etc. Right-hand side where I'm circling, you're going to get formulary information. This is not for billing purposes. This is to make you aware, does the insurance company cover the medication? If they don't, we will provide a generic alternative. There's an example of that here that I'll go through that you'll actually see this, but we'll provide you that information. We've taken it a step further as well to include their benefits, so it's a benefit check. And essentially what it will do is pull up the pharmacies that they typically go to, provide you the cost of the medication based on your insurance plan at those different pharmacies, allowing you to provide more patient satisfaction in terms of you can point them in the direction where it will be least expensive for the medication they need. So that kind of information will automatically pop up. There's not an example, unfortunately, in my demo account, but that is actively working, et cetera, in our live software. But like I say, it will pop up and say CVS, Lipitor is $10, something to that effect. Going down in the middle of the screen here are all the medications that this patient is taking. Excuse me. This will be with any provider. Now, I do have my sample patient on all sorts of crazy medications here, as you can see, so this is not necessarily medically correct. This is for demonstration purposes, but yes, otherwise Kara would be all over the place between the Adderall and Xanax and oxycodone, et cetera, but it will provide a demonstration of how this works. You can add allergies if you like. You can add diagnosis if you like. You don't need to, but this is the kind of information you can certainly add. Below here is where the prescription will actually pen. So I'll show you what that looks like. And then when you're actually prescribing, there's 3 ways to prescribe. I'll point those out. The first one I'm going to do is simply renewing the medication, probably the most common way once you're actually actively doing this. So from here, same idea as the app. A lot of this, it's very intuitive, pointing and clicking. So what I'm going to do is use Adderall. It gives me a good example of how this works. But I'm just on the right-hand side here, and I'm going to simply renew the medication. So I click that icon, and now what is going to happen? So here's actually an example of the formulary alert I mentioned. If the main, what do I want to say, medication is not covered, we'll give you a generic alternative. I'll click prescribe anyway. Now at the bottom of the page, we're going to have this prescription pending. So here you can see the Adderall. We're still on the same page. I'm going to enter a signature password. We set you up with this when you first start. I'm going to click send. If this was a non-controlled medication, it would have gone to the pharmacy right then and there. Since it is controlled medication, we will take this a step further. As I briefly mentioned before, this is where the 2-factor authentication comes into play. And so I'm going to check mark the Adderall again. I'm going to enter a passphrase and a token. The passphrase here again, this stays the same. We'll help you set this up when you start. And then we're going to enter a token number. So what I'm actually doing is I'm logging into my phone right now and I'm viewing the app. And it's giving me 778079. I'm I'm going to click sign. Is now going to go to the pharmacy. And then I will see that it has gone to the pharmacy. A few ways we can see this. One, immediately within the medication history, it will show the last written date. So it's showing today's date. There are also, what I'm hovering is on the upper left-hand corner, reports. You can pull reports on everything sent, so you can keep tabs on this. So you can pull all the medications sent, do this by provider. It will have more of a detailed timestamp in terms of the date it was sent, the time it was sent, the medications, etc. But that's how you'll immediately see that it was sent to the pharmacy. And then, like I say, you can pull these reports. All functionality that I'm going through on this can be printed. So if you need to print any of this for any reason, you can do so. So that would be how you'd renew a medication. The other two ways you can prescribe, in the upper right-hand area now, are you can create a favorites list. So that is this star right here. You can do favorites based on your practice as a whole, if you've got lots of providers, the provider themselves, and then the most recent medications they've actually sent. And so you can create these favorites based on the medication, dosage amount, frequency, etc. So you can see an example of that. And to pull this medication, all I would do is simply click on this line item. And then once I click on that, it will then be a pending prescription, just like I did with the renewal. I'm going to go into create a new prescription, right to the left of there. So I'm clicking on this. This will allow me to pull up any medications. And then this will all be, what do I want to say? So we'll provide the medications, and this again will be based on a dosage amount, extended release, immediate, etc. So I'll type in the first few letters of the medication I want. I'm a bit redundant, but it works well as an example, so I'm going to use Adderall again, but you can see after just typing in the first few letters, it will pull up a list of medications under that name. Click on the Adderall, and then I can do the dosage amount. So I'll go into here, and then I get another formulary alert, prescribe anyway. And so now we're on a signature screen. And so this is just essentially your prescription pad. You're going to be creating this from scratch. All the information you need for sending a prescription, the directions, I should say, are going to be listed in these drop downs. It knows the type of medication you're using. So where it's proper, it will provide injectable or by mouth, etc. So it will recognize the medication that that you're prescribing. So we'll do twice a day as directed. You can do directions to the patient, so you can free text. You can do directions to the pharmacist. They need an easy cap for removal, etc. This is where if you're doing compounds, you can do that in here, and it would be in the directions to the pharmacist. I'm going to put in the quantity. You can split prescriptions too, so it can go to the main pharmacy and then the mail order after day 30. So it gives you some flexibility to work with the customer based on their patient, based on their insurance plan. So I've got information here. I'm going to click review. It's going to bring me to the next screen. It's going to allow me just to essentially view what I put together. All of this information here is what's going over to the pharmacy. And then here is like the information, take with food. Here are the X's I typed in. So this is where that free text will populate as well. From here, you can send the prescription. I'm going to pend it, and we're going to go back to that main screen. And for the sake of demonstration, I'm just going to walk through that two-factor authentication again, just to show you what this looks like. Once I've entered the token, it will stop me because it will recognize I just prescribed this, but like I say, I just want to show you what this looks like. So I'm going to click send. I'm going to enter my passphrase. I'm going to enter my token number. Bear with me, please, as I log in. And so now I'm getting the number of 785212. I will click sign. I'm going to get the alert saying that I just sent the prescription. So this is what we get right here. Go ahead and continue and add. So, and now the Adderall has been sent. So that's how you're sending these medications. Pretty straightforward. Some other items I want to point out that are very popular in the workflow. One, up here in this upper right-hand corner, where it's the bell, this is where we would go into pending. So from the provider standpoint, if the staff has been going through the patients, pending prescriptions, this is where the provider will go into, and they will get the list of all of their patients that have medications that are pending. And it'll all be right here. Non-controlled can be sent in bulk. The controlled medications, you do have to associate a token number next to each controlled medication prescription. However, if you are prescribing more than one controlled medication to that same patient, you can send those in bulk. So if you're prescribing 2 or 3 for whatever reason, you can do all of that at once. But otherwise, you will be routed to enter the token number with each controlled medication. That's what the pending looks like. You'll be able to access the pending prescriptions from the application as well. And then here, next to that bell, is renewals and renewal requests that are coming from the pharmacy side. So the patient has gone back to the pharmacy, asked for something to be refilled. Non-controlled, I know you can do that. Controlled, they'll have to call you anyway. But if the renewal request is coming from the pharmacy side, this is what it will look like. And you can renew, you can deny, you can send notes to the pharmacy, etc. So just to give you an idea of what that looks like. And then it will be routed back to the pharmacy. So that is, the gist of this. There are other, bells and whistles. There is electronic prior authorization capabilities. One we do have added that is popular because Connie mentioned earlier about checking the PMP site. You can incorporate that into the software, and essentially what would happen is we can connect to the state PDMP. There will be a button here, essentially an orange button that will say check state PDMP. You'll click on that, and then within this patient page, you're going to get a box that will essentially be the state interface. It'll look just like if you were to log on there. It will pop up. You can acknowledge that the medication, get credit with the state, and then move on and continue with the prescription. So you just do it all from one page. But I know we're just got a couple of minutes left, so I'm not sure if there are questions, but that is the gist of how you're going to use this. And then I'll put my contact information up here as well. That way, if you've got questions, you can certainly reach out directly to me.
Eric, this is Christine. There was a question that did come through the chat box, and the question was, is the handheld device required, the handheld device that you were sharing, the mobile device? Is that a requirement to use the software?
Yes, it is. You mean, do you have to use the particular software in order for the prescription to go through?
No, the handheld device. Do you have to use the handheld device? Could you do it on
got you. No,
I believe is how the question is being.
I see. Got you. No, it is simply providing flexibility. So you can use this from a laptop, a PC, or on a smart device. The app is not required. It just simply is providing flexibility.
Okay. Another question that has come through is the patient able to access or view their prescription and related instructions through personal devices such as a phone?
They are not going to have access to the e-prescribing software in any capacity. However, you can message them, the script information. That is done through a secure line. It's HIPAA compliant. So that way the PHI is covered. So you can send that information, but they would not be able to, let's say, log on to Dr. First, enter a password, and then view your e-prescribing software. You would actually have to send that to them.
Okay, wonderful. Thank you. If there are other questions, again, please use the chat feature, and we'll be able to go ahead and answer those. So we'll pause here for just a few moments and see if there's any last-minute questions before we let everyone go back to their day.
Colleen Hopkins, thank you very much for clarifying the information about parenteral drug administration. I appreciate that.
Excuse me, with that, it does not look like I have any other questions coming through the chat feature. Just a reminder that today's webinar was recorded and we will be sending it out through an email link, and we'll be posting it on the Health Current website as well. Thank you, Eric, for sharing the Dr. First software and technology that you have developed. And if additional questions come through, we will certainly pass those along. Thank you again, everyone, for participating in today's webinar. Have a wonderful day.
Thank you.
Thanks, Eric.